Have you heard about the latest abortion scandal?
A new undercover report from the pro-life organization Live Action.
Check out this undercover video.
It's all in how vigorously you do things to help a fetus survive at this point. Like, we would not help it.
Pretty damning stuff, huh? But the real scandal isn't what you're seeing in these clips. It's how the clips were made in the first place. Live Action sends pregnant actresses into abortion clinics disguised as patients. The actresses wear hidden cameras, and they try to manipulate clinic employees into saying something stupid. But the secret isn't in the cameras or the acting, it's in the editing. You systematically take out everything that shows the true complexity of abortion and the people who do it. Let me show you how it's done. The first thing we're going to do is rig the whole encounter. We're going to send our actress into the clinic 23 weeks into her pregnancy. She really is pregnant, but we've chosen to wait until this late stage of pregnancy to make it look as though this happens all the time. The truth, which we're not going to tell the audience, is that only around 1% of abortions are performed after 21 weeks. Our actress is going to pretend that she's terrified that her fetus will survive the abortion and be born alive, and that she'll have to take the baby home. And here's the big thing. We don't want viewers to understand that even if you didn't administer an injection that kills the fetus inside the womb, which nearly all of these clinics do, the mere expulsion of the fetus, even at 21, 22, or 23 weeks, is itself fatal. That fetus is not prepared to survive outside the womb. We want to conceal that. We want to make it sound as though this is a normal birth. And any failure to do whatever it takes to keep that baby alive is cold-blooded murder. Let's start with a visit to this clinic in Washington, D.C. Watch how our actress manipulates a clinic employee. Remember, if the people at the clinic say anything that doesn't fit our storyline about them, we'll leave it in the hours of raw footage, which nobody will watch, but we'll take it out of the edited video we're going to promote.
Like, I'm alone, you know, and like, I can't, sorry, I can't believe I'm crying right now, but,
it's okay.
You know, I can't take care of a baby.
This is a brilliant performance. The clinic worker is so moved that she actually comes forward and hugs the actress, which momentarily blacks out the tiny camera the actress has concealed on her torso.
You have to realize that this is a decision that unfortunately affects you deeply beyond anything, and one way or another you have to live with that responsibility.
We're not going to use any of that footage because it would show our audience that the people who work in these clinics are really about morality and responsibility, not about selling abortion. The important thing is that we've got the clinic worker hooked. Now let's see if we can get her to say that they deliver babies alive and then kill them.
So like, when it comes out, like, does it, like, can it like move or anything?
No.
No, okay. So like, it's never happened that it's
No.
like breathing or,
No.
What if it like happened to
No.
me though?
Trust me, you won't.
So it's never happened though at this stage?
So far, no. So
Okay.
far, nothing like that. No.
You've never had?
Mm-mm.
Okay, you've never had a baby?
No.
Okay, so this part isn't going so well. It turns out they don't deliver babies alive and then kill them. But they probably would if the baby came out alive, right? Let's see what the clinic worker says.
No, because then that would have to transfer you to the hospital. It needs to be resuscitated.
Ooh, that's no good. She just said they'd resuscitate the baby if it's born alive. But don't worry, we'll just take that woman completely out of our edited video. Let's go talk to the doctor at this clinic and see if we can get him to play along with a scenario in which somehow the fetus is delivered alive.
I mean, nobody can force you, first of all, to accept a fetus, a baby you don't want. You know, there's always an adoption.
So
Whoa, did he just say adoption? We definitely don't want that in the video. If people see the doctor bringing up adoption, they'll stop believing our message that abortionists just want to kill babies. Let's let the tape roll a few seconds longer.
But you are sure that this is what you want to do?
I'm not 100% sure. I'm not.
You're the only one that can make this decision.
Wait, did he just ask her to reconsider whether she wants the abortion? That is definitely not going into the final video. Let's move on to another clinic. This one's in the Bronx. Maybe we can get some incriminating footage from a counselor there.
it looks like a baby.
It is.
Yeah.
At this point. So are you sure that you want to do this termination? I mean, have you thought about this? When did you find out you were pregnant? Are you sure you want to do a termination? Because you knew that you were pregnant when you were 2 months. So there's somewhere or another you were thinking about continuing this pregnancy.
Yeah.
So what changed your mind from then to now?
Well, I don't really feel like talking about it.
Okay, I mean, you don't have to go into detail, but there has to be, is there something that can be rectified and then you want to continue this pregnancy? Because
Ugh, this is terrible. We're trying to paint these clinics as villains. But once again, the counselor sounds like she's trying to talk the woman out of the abortion. Don't worry. We'll just edit all of that stuff out of the video. Let's see what the counselor says about the born alive scenario.
Because once that pregnancy comes out, and if it is breathing and it's moving, then we have to resuscitate it. Because he's an OBGYN. He doesn't just do terminations, he delivers pregnancies too. So once that pregnancy comes out alive, he will do everything he can to save it. Okay?
Okay, that's even worse. She's saying that the doctor would do everything possible to save the baby, not just because it's the law, but because he's an OBGYN. She's ruining our whole distinction between evil abortionists and the nice doctors who deliver babies. So let's get rid of that part too. Now let's try one more clinic. This one's in Phoenix, Arizona. Here's our session with the doctor.
In case this helps put it all in perspective, even if you were pregnant at the same time with a very desired pregnancy, and you had the exact same thing happen spontaneously all on your own at 23 weeks and 2 days in the hospital, we would still say, do you want us to try to resuscitate? Our chances aren't good, but if it will make, it's kind of one of those things that if it makes the parents feel better, we'll give it a shot between 23 and 24 weeks.
But you won't give it a shot for me though. Like you'll just...
Absolutely not.
Okay, because if I'm paying for it, you know, it's like I don't want to walk out of here with the baby.
Absolutely.
Okay.
No. But I'm just trying to, even if it was a completely the flip side, where it was a baby you wanted, your odds are still
slim.
Right. Like there's just no, like babies just don't survive this.
But you just wouldn't take that extra
and
step
we just
to
wouldn't
resuscitate.
go through all the resuscitation. And even in the desired pregnancy, we 9 times out of 10 don't resuscitate.
That's probably the most damning segment in any of the videos. But it's not damning for the doctor. It's damning for the people who made the video. The actress is trying to put words in the doctor's mouth. If I'm paying for it, she says, I don't want to walk out of here with a baby. But the doctor, who thinks she's talking to a real patient, says that's not the point. The point, according to the doctor, is that the clinic wouldn't treat a momentarily surviving, grossly premature infant any differently than a hospital would. A baby born at this stage doesn't die because abortion clinics practice infanticide. It dies because it can't be saved. And what does the doctor get for this display of integrity in what she thinks is a private moment? This. Live Action uses her to illustrate what it calls infanticide. Everything the doctor said about treating a born-alive baby exactly the same as she would in a hospital has been completely edited out of the video. So now you know who the real villains are. It isn't the doctors and counselors, it's the actresses and video editors who frame them for infanticide.